Hi everyone, the topic for my presentation is ovarian cancer in the United States. For topic selection and research question, what was the main motivation for selecting this topic? First of all, my main research question is what is the prevalence of ovarian cancer in the US? And then it is divided into subcategories. Ovarian cancer is one of the most commonly diagnosed cancer in women after breast cancer. This kind of cancer causes more deaths in women than any other cancer-related diseases of the reproductive. Questions that I answered from my data analysis was basically what were the subcategories of ovarian cancer, and then what was the estimated new cases of these different types of subcategories for women in the year 2020, and then the estimated deaths of different types of ovarian cancer for women for the year 2020. And then what is the age-wise percentage of ovarian cancer diagnosis of women in the United States? And the year range was between 2009 to 2020. State-wise analysis of the survival rate. And then to dig in a little deeper, I analyzed the race-wise analysis of patient insurance, what kind of insurance they had, and the patients who were diagnosed with cancer had no insurance at all. And then to analyze what is the most prevailing type of ovarian cancer, either is it malignant or is it borderline. Once that was categorized, I wanted to see the percentage of women suffering from ovarian cancer that is malignant. And then what is the survival rate of women who have the cancer type malignant and borderline. And finally, I analyzed the data for cancer diagnosis by ethnicity and race. For the data pre-processing and analysis part, I searched through various websites, but the main ones were CDC, Center for Disease Control and Prevention, National Cancer Institute, and GitHub. I managed to gather 3 different types of data sets for my analysis for these 3 sources. The main data set was from CDC, and then supporting smaller data sets were from National Cancer Institute and GitHub. For data discovery and profiling, I explored all 3 data sets to better understand what it contained and how it would help with my analysis. I was able to identify inconsistencies in the data sets like missing data values or outliers or negative values or various attributes that were completely null. For the data processing and analysis part, first I did data cleaning and transformation. This is, for example, for the age attribute. For the given upper age attribute limit and the lower age limit attribute, I took the average age for each row. I created average bins. I joined the 2 additional data sets using the age range and year. I removed attributes with null values. I removed any outlier negative value in the data set. The numerical value, missing values were replaced by average number. Data relabeling for understanding, for example, the race attribute had confusing observations for defining race, so I relabeled the observations. Attribute selection and removing attributes that contain no data or were not relevant to the analysis. This is my first visualization. That in the dataset I had all the cancer categories for women. So for first of all, I wanted to show the subcategories for ovarian cancer. So I created a new field calculation category that grouped ovarian cancer, and there were of 4 kinds, that is cervical, fallopian tube cancer, ovarian cancer, and uterine cancer. And I labeled it as ovarian cancer and all the other type of cancers as others. And then I applied it as a filter and only selected to show the ovarian cancer. Then I created a new field calculation to compute the percentage of new cases. I created a new field calculation to compute the percentage of estimated deaths. And then I created a new field calculation for each type of ovarian cancer death percentage. For analysis, sum of estimated deaths for each type broken down by category and color categorization. This is just to show the entire visualization. There were 2 categories defined, like I previously explained, ovarian cancer and other, so I filtered this other just to focus on the ovarian cancer. For my second visualization, I wanted to display the percentage of new cases with respect to age. For this, I created a new calculation field to calculate the percentage of new cases. I joined the second data set with first one using the age range attribute. I added a reference line to show the overall average of percentage of new cases, and then I I calculated the sum of percentage of new cases for each age range, and then the marks are labeled by sum of percentages of the new cases. So this is basically age bins defined less than 19, 20 to 30, 31 to 40 years, and then this is the percentage of new cases occurring, and you can see that the highest number of age range where women are at a high risk of developing ovarian cancer of all four types is between 51 to 60 years. My third visualization was to see on average what is the greatest number of survival cases, and for this I split the state county attribute to create a new attribute, because that attribute had identification numbers with the name, so it was confusing. Then I calculated the average number of survival years for patients state-wise, and then I created survival indicator based upon attribute survival months after diagnosis. First I converted the months to years, and then I calculated the number of years after diagnosis. The patient who had the survival year 2020 and beyond were marked as yes for alive, and whoever had less than 2020 were marked as no for dead. For my fourth visualization, I wanted to show race-wise categorization of patients who were diagnosed with cancer and who had insurance or not. For this, I created a new calculated field to rename the race values. I calculated average insurance. I used race relabeling. Moving on to my next visualization. In this, I wanted to see that the type, the cancer type malignant, what is the per average age of women that have malignant cancer. And for this I created a new calculated field relabeled as the behavior attitude. Then I took the average age is calculated and displayed to show the average age of women who suffer from different types of ovarian cancer with type malignant, and then average of age of for each type of ovarian cancer broken down by cancer type, malignant or borderline, and the view is filtered to show just the average cancer type of malignant. And then this is a trend line graph that shows from 2009 to 2020 the patients diagnosed with the two types, borderline or malignant, and the survival indicator. And you can see that the survival rate increases over time. For my last visualization, I wanted to show the cancer diagnosis by ethnicity, and you can see that ovarian cancer occurrences per 100,000 women is more in black women than white women, but the gap has narrowed over the years. And for the conclusion part, I was able to conclude that in United States, 12.5% of every 100,000 women on average are diagnosed with ovarian cancer each year. Fallopian tube cancer had the highest number of deaths, with a record of 36,120, and highest number of new cases, which was 61,483 in the year 2020. Women in the age bracket of 51 to 60 years are at the high risk of developing ovarian cancer. The highest number of ovarian survival cases are in California, with an average of 7%. Ovarian cancer occurrences per 100,000 women is more common in black women than white women, but the gap has narrowed over the years. Since 2009, there has been an overall increase in the average number of survival cases for both type of malignant and borderline, with an overall average of 56% survival cases for malignant and 51.5% survival cases for borderline till 2020. This was my dashboard visualization and story. This is it for my presentation. If you have any questions,